Hello everyone. So I am Karthikeyan, and it's indeed a great pleasure to meet you all through a video in the webinar. So it's the very first time. So I've been traveling with Agam webinars for almost 1 year, and this is the first video that I'm doing with turning on my camera. So it's a very special moment for me, and also for I hope it will be for you too. So today's class is about perineum. So before getting into the region, talking about the anatomy, the purpose of me coming through a video is to explain you the region of perineum first, right? With no basic things that we have at our kitchen appliances and bedroom appliances. I'm going to explain you perineum. I want you all to understand what I'm going to tell you first. Then we are going to get into the anatomy, right? So when we say perineum, it is the most complicated topic, like most difficult to understand the region, the structures, but very, very, very important topic. You get to obstetrics and gynecology, you get to surgery. The topic that will be spoken every time is perineum, right? So I have divided this into two videos. Today we'll be talking about one half of the perineum. Tomorrow we'll be talking about another half, right? So please pay attention. Now, first, we are going to understand the region. So what is the perineum, right? Now, I want you all to assume this 𝗔 to be the pelvic bone. So unfortunately, I don't have a complete bone. So imagine this particular 𝗔 to be your pelvic bone, right? So this is the entry. So this is where we pour all our contents, and this is the region where we'll sip and we'll drink. So this is the inlet, right? And this side, it is closed. And suppose if this would have been an open region, this is the outlet. So a pelvic bone, right? It is open at both the sides. So one side is called as the pelvic inlet, other side is called as the pelvic outlet, right? So this region of pelvic outlet that is present is called as perineum. So the very first thing that you must know is the location of perineum that is located at the pelvic outlet, or I can say pelvic outlet is the region of perineum. So this pelvic outlet is going to be a diamond shaped structure that is your perineum, right? So the first basic information is you have to know about the region of perineum. Yes, what is the location or the region of perineum? It is the pelvic outlet, right? This is the first point. We'll see all the anatomical aspects later. So the second thing, before that, I want to show you one thing. I'm really fond of teddy bears, right? So I've got lots of collection. It's like I can, if suppose I become a YouTuber in future, I can make a vlog with teddy bears. So I've got lots of collection. This is a teddy bear I've got, and I've got lots of teddy bears there. So why I introduced about teddy bears is I'm going to use this as a subject and explain you. So this teddy bear, it was gifted by my parents on last birthday, and this teddy bear, it was gifted to me on my 10th birthday. So almost it is with me for 11 years, right? So let us get back to perineum story. So, right, as you're able to see. So say suppose this region is the pelvic region, right? So this region is the pelvic region, and I am asking the teddy to lie down in the lithotomy position. So with the legs flexed and the perineal region being exposed, right? So this is the perineal region. Yes, can you make out? Now, how can I approach the perineum layer? This is the second thing that you must know, right? What are the layers? If suppose I ask you about the anterior abdominal wall, you will say skin, superficial fascia, deep fascia, rectal sheath. You will be telling about all those structures, right? Similarly, how to approach the perineal structure? So what are the layers? Yes, first thing I'll be having the skin, right? So the moment I open the skin, I'll be having superficial fascia. Then I'll be having deep fascia. Then I'm going to have a space, right? I'm going to have a space. That space is called as superficial perineal pouch. Then if I reflect the pouch, I'll be having a perineal membrane. If I reflect the perineal membrane, I'll be having another space or pouch that is called deep perineal pouch. Then I'll be having deep fascia of urogenital diaphragm. right? See, just know the name so that you will be understanding. So this is the region, this is the perineal region. So I'm just trying to reflect every single layer, and the names that I listed out in order: skin, superficial fascia, deep fascia, superficial perineal pouch, perineal membrane, deep perineal pouch, and the superficial fascia of urogenital diaphragm. So all these are the layers that we are going to slowly expose and understand, right? So this is the second point that you must know, right? So this is the perineum region, right? So you are able to see the thigh, right? Unfortunately, it's steady, but in a human body, this will be the thigh, right? And here you'll be having your genitals, right? So you'll be having scrotum and mons pubis in females. So we are going to understand this is the buttock region. So these are the boundaries of perineum, right? Can you appreciate? So this is what we are going to see today, right? So this is what you must understand. So what is a perineum, where it is located, and what are the layers of, in order in which I'm going to understand the perineal structures. So this is the pelvic bone. So if a person is going to stand, this is the pelvic bone, and this is how this bone is going to be oriented. So I'm going to view the bone like this, right? So I have just cut the person till its hip level. So I have just have the pelvic bone, and I'm going to observe the pelvic structures like this, right? So when I observe in this direction, right, from superior view, right, from the top, I'm trying to view the pelvic. So I notice the perineal structure. So the perineum structure is going to be a diamond shaped one. So in our normal humans, the perineum is going to be like this, right? So I'm going to view the structures like this, but for your understanding, I have just reflected and I'm showing you. So perineum is going to be a diamond shaped structure, right? Now, here if you take, I have written two regions, urogenital, anal, by drawing a line in between, right? So the perineal region can be understood at two levels. One, dividing it into a urogenital triangle. The other one is the anal triangle. So before getting into the anatomy, you should know something called as a pelvic inlet. You should know something called as the pelvic outlet. You should know what is the layers in which you will approach the perineum. And you have to know that there are two triangles. A perineum is a diamond shape with two triangles, urogenital and anal triangle. So in the front, so the person is standing like this, right? So in the front, what I will be appreciating are the urogenital structures. In the back side, I'm going to appreciate the anal structures, right? So this is the perineum, right? So if you have this basic idea, it is going to be very easy. So do not forget my teddy. You should not forget my teddy for lifetime, right? So this is the region of perineum. So with this, I have told the external boundaries, right? So posteriorly, I've got the buttock region. On the lateral sides, I have got the thigh, right? Above, if it is male, we will be having the scrotum. If it is female, we'll be having the mons pubis, right? We'll see the internal boundaries now. So this is about the region of perineum, right? I hope you all understood. So let us get into the PPTs and quickly look into the region. So what we are going to see today, the objectives. Yes, we are going to talk about the boundaries, and we are going to talk about a very important point, that is superficial and deep perineal pouches, along with something called as perineal body. We are going to talk about these three things. So I have told you already. So this is the pelvic inlet. So if you remember, yes, I showed the cup, right? So this is the pelvic inlet. So pelvis is like this. So I'm going to observe the boundaries of this. So this is my pelvic inlet. If I'm going to turn it upside down, right? I'm going to turn the pelvic bone upside down. I'll be seeing the pelvic outlet structures, right? So I have this orientation in your mind. So let us look into the boundaries. Yes, the pelvic inlet would have been already covered. Yes, so this is the pelvic inlet. So this region, let me use an highlighter. This region is my pelvic inlet. Yes, yes, very good. So what is the anterior boundary? So anteriorly, if you take, it is bounded by the pubic symphysis. Yes, anteriorly it is bounded by pubic symphysis. Posteriorly, I have got the sacral promontory. And on the lateral sides, I have got iliopectineal line. Yes, iliopectineal line. So anteriorly pubic symphysis, posteriorly sacral promontory, and on the lateral sides, I have got the iliopectineal line. So this is the boundary of pelvic inlet. This is not our perineum, right? This is the pelvic region. Yes, this is our pelvic outlet, that is your perineum. So if you can see, yes, what I am tracing is a diamond shaped structure. Oh, sorry. Diamond had been crushed here. I'm sorry. So, yes, just trace that. You will be able to get it, right? Yes. So, this is the diamond shaped structure. So, this is my perineum. Yes. So, just see how the pelvic bone had been. It had been tilted upside down, right? So, I am just tilting the pelvis bone like this. It's not actually upside down to 180 degree maybe. Yes. So, I am able to appreciate a diamond shaped outlet here. This diamond shaped outlet is called as your pelvic outlet or your perineum, right? So now we are going to study the internal boundaries. The external boundaries, I told you, right, using the teddy, like scrotum, the buttocks, and the lateral aspect, medial aspect of the thigh forms the lateral boundaries. Those are the external aspect, but internal boundaries are formed by the bone itself. So anteriorly, if you take again, you have got the pubic arch, right? So the anterior boundary is formed by the pubic arch. Posteriorly, you will have the coccyx, right? The pelvic inlet, it was formed by the sacral promontory, right? But here, the posteriorly, the pelvic outlet or the perineum is formed by the coccyx. On the lateral aspect, yes, you will be having some tuberosities, some projections. Those are called as ischial tuberosities and the ischial spines. So the perineum is the diamond-shaped structure. Yes, it's a diamond-shaped structure that is formed anteriorly by the pubic symphysis or the pubic arch, posteriorly by the coccyx, laterally by the ischial spine or the ischial tuberosity. Right? So if you see, I showed you a cutting, right? Paper cutting, where I made a diamond-shaped structure. And can you appreciate I have drawn a line? So these are the two projections, right? So this is my pubic symphysis, this is the coccyx, right? And these two are my ischial tuberosities. So there is an imaginary line. Yes, there is an imaginary line that runs in between the ischial spine or the tuberosities. Yes, an imaginary line that is going to connect both the lateral ischial spines and divides the perineum into two regions. One is the urogenital triangle. Another one is the anal triangle. Right? So anteriorly, I've got the urogenital triangle. Posteriorly, I've got the anal triangle. Right? You all know this. Like anteriorly, we have got the genitals. Posteriorly, we have got the anal canal. Right? Everybody knows. So this is what is the internal boundaries. Right? Now, externally, yes, I have already told you. So just remember my teddy. Right? As I told you, you should not forget teddy for perineum. Just again, we'll turn on the video. Is just compare these two. Okay, the picture that is put on the slide along with the teddy that I am showing you, right? So anteriorly, if you take what you will have a scrotum. If it is males, it is scrotum. If it is females, it is mons pubis. Posteriorly, you have got the buttocks. Laterally, you have got the upper medial aspect of the thigh. So this is the perineum region with all these boundaries, right? So the first part, we have just seen the boundaries of perineum, right? So we saw the boundaries of pelvic inlet. We are more concerned about the pelvic outlet because that is what is called perineum. So it's a diamond-shaped structure or a diamond-shaped region which is bounded anteriorly by the pubic arch, posteriorly by the coccyx, laterally by the ischial spine. And if you take the external boundaries as anteriorly to scrotum if it is males, anteriorly if it is female, we'll be having the mons pubis. Posteriorly, yes, we'll be having the buttocks. On the lateral aspect, we'll be having the medial aspect of the thigh. Right? So this is about the perineum boundaries. And just now I told you, yes, can you make out this is the pubic symphysis, this is the coccyx, and these are the ischial tuberosities. Can you see an imaginary line that is going to pass? Yes, there's an imaginary red dotted line. So this imaginary line connecting the two ischial tuberosities, it divides the perineum into two triangular spaces. One is the urogenital triangle, another one is the anal triangle. One is urogenital triangle, another one is the anal triangle. So today we are going to talk about the urogenital triangle and the perineal body. And tomorrow we will be talking about anal triangle. Right? Now, what are the layers? Yes, I would have already discussed, right, with the teddy. So first you will be seeing the skin. Then you are reflecting, you will be finding the superficial fascia. then the deep fascia, then you have the superficial perineal pouch, then the perineal membrane, the deep perineal pouch, superficial fascia of urogenital diaphragm. Now, what is a urogenital diaphragm? See, in last class, they would have discussed about the pelvic diaphragm. So, what is the role of a diaphragm? Is the diaphragm is going to separate two regions. Now, we have got a diaphragm at the thorax level, right? So, it separates the thoracic region from the abdominal region. Similarly, what is pelvic diaphragm? Is it is going to separate the pelvic region from the perineum. So, similarly, I've got the urogenital diaphragm that is going to line the internal structures, like it will be present between the bladder and the deep perineal pouch, right? So you'll be seeing. So if I reflect the urogenital diaphragm, the next structure that you approach is the viscera, your bladder, prostate, and all that, right? That is the urogenital diaphragm. So students usually get confused, or even when we were studying, we do not understand what is a pouch, how it is located, and all that. Now you can easily tell the boundaries of both the pouches. So you have got two pouches, superficial perineal pouch and deep perineal pouches. What are the boundaries of superficial perineal pouch? Yes, it is sandwiched between deep fascia and the perineal membrane, right? So first I will have the skin, I will reflect the skin, I will have the superficial fascia, reflect the superficial fascia. I will have the deep fascia, reflect the deep fascia. I found a space that is called as a superficial perineal pouch, right? And on the other side of the superficial perineal pouch, I have got the perineal membrane. So the superficial perineal pouch is between, right? This is the superficial perineal pouch. It is bounded above by the deep fascia and below by the perineal membrane, right? Now I open this perineal membrane. What I am going to appreciate, another pouch, that is your deep perineal pouch. So the superficial perineal pouch boundaries, as it is between your deep fascia and then your perineal membrane. I reflect the perineal membrane, I will be having the deep perineal pouch. So the deep perineal pouch boundaries is above by the perineal membrane, below by your superficial fascia of urogenital diaphragm. Hope you understood, right? So this is what you have to know. Again, Teddy, I told you perineal region I am exploring. So skin, then superficial fascia, deep fascia, right? Then I will be appreciating a pouch, superficial perineal pouch. Then open, I will be appreciating the perineal membrane, right? Then if I reflect the perineal membrane, I'll have the deep perineal pouch. Then I'll be having the urogenital diaphragm along with its associated fascia. Then we'll get into the viscera, right? So these are the layers. Now, if you understand the layers, it is very easy to study the boundaries of superficial and the deep perineal pouch. So I hope you understood the layers and the boundaries, right? Now we'll just look into picture and understand. So this is a picture given in your Vishram Singh. Yes. Yes. So this is the picture. Now, how will you understand this picture? As see, this is the penis. This is the superficial fascia of your abdominal wall. So what happens to the superficial fascia of the abdominal wall? Yes, what will happen? The superficial fascia of abdominal wall itself will have two layers, a superficial layer and a deep layer, right? So this deep layer of superficial fascia of the abdominal wall, yes, they would have already taught you, will enclose the glans penis, right? Will enclose the glans penis, will take a turn, will cover the scrotum, right? And it is going to continue as your 𝑘𝗠𝐠 fascia. So this 𝑘𝗠𝐠 fascia is the deep fascia that I was talking about in the previous slide. Yes, if you remember, we saw the superficial perineal pouch was sandwiched between the deep fascia and the perineal membrane. So what is that? Is the deep fascia from the abdominal wall. It covers the glans penis. It gets a U-turn. It is going to cover the scrotum. Then it is going to extend backward as a deep layer, and that is called as 𝑘𝗠𝐠 fascia. Refer superficial fascia of abdominal wall. You will understand the structures better, right? So yes, this is what we are talking here, right? So this is the 𝑘𝗠𝐠 fascia, right? This is the deep fascia, and this is the perineal membrane, right? So all these are your deep fascia, right? So between your deep fascia, yes, and your perineal membrane, I appreciate a pouch. That pouch is called as superficial perineal pouch. Did you understand what this picture is trying to convey? Yes, this picture is telling the location and the boundaries of the perineal pouches. So the superficial perineal pouch is located, or it is between, or it is bounded by the deep fascia of the abdomen, or the 𝑘𝗠𝐠 fascia, and the perineal membrane above. So this is my perineal membrane. And this is the perineal membrane. This is the superficial fascia or the superior fascia of the urogenital diaphragm. In between them, yes, we get a space that is called as the deep perineal pouch. Yes. So this picture is going to convey the location and the boundaries of the perineal pouches. Yes, very good. Now, we'll see what is there in the next slide. Now, so this is the picture that we took from Netters. I want you all to observe this picture carefully. This membrane that you're able to observe is the perineal membrane. Now, can you tell me all the structures that are present as they are the contents of? Yes, very good. They are the contents of superficial perineal pouch. The purpose of me putting this picture is to make you understand you all how these pouches are located. Yes, again and again, the main objective or take-home message is the boundaries of superficial perineal pouch. You can memorize the contents, but if you're not going to understand the boundaries, you will never understand perineum. But if you're going to understand this, you will never forget perineum, right? So this is the perineal membrane. So this region, right? So let me turn on my video again. So see, my palm is the perineal membrane that has been shown in the picture, right? So what are the layers I would have taken away? Yes, I have taken away the skin. I have taken away the superficial fascia. Then I have taken the deep fascia also. So I am appreciating the contents. Yes, so all these are my contents. And below I have the perineal membrane. So all my contents have been sandwiched between the deep fascia above and the perineal membrane below. Here the deep fascia had been removed and the contents in the perineal membrane have been showed. Yes, and you're able to appreciate some muscles here, right? The superficial perineal muscles and all that. We'll see that, right? So this is how a superficial perineal pouch is located in the perineum, right? So this is the inferior view. Are you able to understand? I showed you, right, in the 𝗔𝗶𝗶𝗃 approach. So that is the view here. So we'll see the next image. So we are going to study the contents of superficial perineal pouch, right? So first is, in male, you will be having root of penis. And here, you will be having root of clitoris, right? Female genitalia. So root of penis, root of clitoris. Then I will be having certain muscles. So we'll name the muscles. Yes, so what are the muscles that will be found is, in both male and female, muscles are all same. Only the names of arteries and the genitals will change. So yes, I have got three muscles. The first one, it is a superficial perineal pouch, right? So I have got the superficial muscles, right? Here, superficial, I'll show you in the next picture, transverse perineal muscle. So the muscles are superficially located. They are transversely arranged and it is in the region of perineum, hence the name superficial transverse perineal. Followed by 𝗵𝗏𝒂𝗏𝒃 muscle. Followed by 𝘊𝐶𝑖𝑜𝐿𝐵𝒃 muscle. So these are the three muscular contents in the superficial perineal pouch. Yes, superficial transverse perineal, 𝗵𝗏𝒂𝗏𝒃 muscle and the 𝘊𝐶𝑖𝑜𝐿𝐵𝒃 muscle. Then we will be having urethra. Okay, you will be having urethra. In the female, again urethra. Right? Then very important for your MCQ exams. Yes, please make a note. In the males, yes, the duct of bulbourethral glands. Sorry, Bartholin is a female gland. The duct of the bulbourethral glands, they open in superficial perineal pouch, whereas the Bartholin gland is a content of female superficial perineal pouch. Why did I stress on this point is, see, when we look into the contents of deep perineal pouch in the male, I will tell you bulbourethral glands. So if somebody asks you bulbourethral gland is a content of, then your answer should be deep perineal pouch. If somebody asks you duct of bulbourethral gland is a content of, superficial perineal pouch. So duct is going to open in between the deep fascia and the perineal membrane, but the gland is present even more deeper, that is between the perineal membrane and the superficial fascia, superior fascia of the urogenital diaphragm, that is your deep perineal pouch, right? Whereas the Bartholin glands are present in females in the superficial perineal pouch, and it is not present in the deep perineal pouch, right? Then last one is your arteries. So all your branches of internal pudendal artery will open into the superficial perineal pouch, mainly perineal artery, then dorsal artery of penis, then deep artery of penis. Dorsal artery of penis, deep artery of penis. In females, the same names, perineal artery, but instead of dorsal artery of penis, it is dorsal artery of clitoris. Similarly, instead of deep artery of penis, it will be deep artery of clitoris. It will be deep artery of clitoris. So this is a picture showing the muscle. So this is the superficial perineal pouches. Can you make out? Here I have got the perineal membrane, and here the deep fascia has been reflected, so I am able to see the muscles. Yes. So this is my 𝗵𝗶𝗴𝗂𝒂𝗃 muscle. This is the 𝘥𝒂𝗵𝗂𝒃 muscle, and this is the superficial transverse perineal muscle, STPM. Right. So these are the muscles. What are the contents? Yes, root of penis, I will just see in males. So females you can write root of penis, you have 3 muscles: superficial transverse perineal muscle, 𝗵𝗶𝗴𝗂𝒃 muscle, the 𝘥𝒂𝗵𝗂𝒃 muscle. You have urethra, then duct of bulbourethral gland, and vessels, perineal artery, dorsal artery of penis, deep artery of penis. Also you will have pudendal nerve and its branches. Okay. Pudendal nerve will be tomorrow's session. So you will have 2 branches. One is your perineal nerve and dorsal nerve of penis. So in females, it will be perineal nerve and dorsal nerve of, yes, very good, clitoris, right? So these are the contents of superficial perineal pouch. Now, what is this picture? Again, it is very familiar to this picture. Yes, here you can easily tell me what I have done. Very good. I have cut open the perineal membrane. Yes, can you see? That is the perineal membrane. So I have cut open the perineal membrane. So what I am able to appreciate here is the contents of deep perineal pouch. So now are you able to understand how the pouches have been arranged? Yes, it is like a 𝗏𝒵𝒃 burger, or it's like sandwich, right? Layer by layer by layer it is arranged. If you take 𝗏𝒵𝒃, you will have the bun. Then you will be having some veggies, and you will have a layer of cheese with that potato fry. Then again you will have a bread. Then you will have huge amounts of cheese with again the lettuce and other contents. Then again you will have the bread. This is how the perineal structures are also arranged, right? So here I have cut open the perineal membrane, and what I am observing is the deep perineal pouch, right? So all these contents are the contents of deep perineal pouch. So let us study the contents of deep perineal pouch. It is very simple. You will have urethra in males, and you will have urethra and vagina in females. Urethra is a content of both superficial and deep perineal pouch, but vagina is a content of deep perineal pouch, not superficial perineal pouch. And as I told already, duct of bulbourethral gland was a content of superficial perineal pouch, whereas the bulbourethral gland itself is a content of deep perineal pouch. So these are the contents of deep perineal pouch. So the bulbourethral gland itself is a content of deep perineal pouch, right? Then you'll be having 2 muscles, superficial perineal, in the superficial perineal pouch, yes, we have 3 muscles. Here you'll be having 2 muscular contents. Yes, mainly deep transverse perineal muscle. There was superficial transverse perineal muscle there. Here it is deep transverse perineal muscle, right? And the external urethral sphincter muscle. I'll show you the picture now. Urethral sphincter muscle. Right, same thing will be applicable for females also, right? Then I have told you about the bulbourethral gland, and you will be having the internal pudendal artery branches again, which will extend into the deep perineal pouch also, right? The perineal artery, then you will have your, mainly you will be having your deep artery of penis and the clitoris, right? Dorsal and the deep arteries of penis and the clitoris will be the contents of respective sex. Then you will be having the dorsal nerve of penis and clitoris. And here you will be having dorsal nerve of clitoris. So the deep branch is, so your deep artery of penis, dorsal artery of penis, dorsal nerve of penis are the contents of male deep perineal pouch. Then the dorsal artery of 𝗲𝗏𝗃, deep artery of 𝗲𝗏𝗃, and the dorsal nerve of 𝗲𝗏𝗃 is a content of female deep perineal pouch. Right? So if you look at this picture, yes, this is the urethra. So this is male. How did I identify it as male? Yes, I do not have two openings, right? So usually urogenital triangle, if it has two openings, one will be for urethra, another will be for vagina. Here I don't have vaginal opening. So this is only urethra. So it's a male deep perineal pouch. So this is the urethra. Surrounding it, I am able to appreciate some sphincter-like muscle. So that is my external urethral sphincter. Yes, can you appreciate this glands here? So this is my bulbourethral glands. And can you appreciate certain muscular fibers running in a transverse direction? Yes, this is my deep transverse perineal muscle. Yes, so superficially, if you go, you'll be having the superficial transverse perineal muscle. I reflect this muscle, then I reflect the perineal membrane. What I observe is the deep structures. Yes, so those are the contents of deep perineal pouch. Right. The last topic is the perineal body, a very important structure. Right, so especially when females, it plays a very important role. So what is a perineal body? Yes, it's a very important short note for a university exam also. It is wedge-shaped. Yes, it is going to be wedge-shaped fibromuscular mass. So it is formed by certain muscles. Just can you make out from this picture? This is a muscle, this is a group of muscle, this is a muscle. Then from the deeper aspects, you have got certain muscles. So it is formed by certain about 6 groups of muscles. So it's a fibromuscular mass. It's a wedge-shaped fibromuscular mass. Yes, where it is located. This picture will be simple for you. Yes, can you see? In between the junction of urogenital and the anal triangle, right? So it is located in the junction of the anal and the urogenital orifice, right? It is located in between the junction of urogenital, I read it as UG, and anal orifice. So it is located at the center, superficially located. Okay, it is superficially located and it is located in between the junction of urogenital and the anal orifice, and it is formed by certain muscles, right? So this is a picture given in your textbook. So this is the perineal body. I'll use a pointer. So this is the perineal body and I am able to appreciate certain muscles. So what are the muscles that will form? Yes, first let us talk about the superficial muscles. Yes, what are the superficial muscles of the perineum? Yes, very good. You will be telling me that one, yes sir, we have seen in the contents of superficial perineal pouch, yes, the same muscles, superficial transverse perineal muscle. The second one, 𝗵𝗶𝗴𝗃 muscle. Third one, 𝘊𝒂𝐿 muscle. But one thing here is the perineal body is not formed by this third muscle. Yes, this is my superficial transverse perineal muscle. This is the 𝗵𝗶𝗴𝗃 muscle, right? So both of them are going to interdigitate and form perineal body, right? So superficially you have these structures. So you will have 2 tendons of superficial transverse perineal muscle, 2 tendons of 𝗵𝗶𝗴𝗃 muscle. So totally 4 muscles are done, right? 2 groups of muscles, 4 muscles have been done. Third one. So you will highlight as and when we finish the muscles. So I have completed about superficial transverse perineum. I have completed about 𝗵𝗶𝗴𝗃. Now we are going to look into deep group of muscles. So the deep muscles, yes, you will be having deep transverse perineum, right? So again 2 muscles. Can you appreciate? From this side you have one group of muscle. From this side you have got one group of muscle. 2 deep transverse perineum muscle. Then these are the levator ani muscles. Levator ani muscles, right? Then you will be having the external anal sphincter 1 muscle. Then the longitudinal muscle of anal canal. You all know GIT, it is lined by 2 muscular layers, the longitudinal layer and the circular layer, right? So the longitudinal muscular layer is also going to contribute to perineal body, right? So what is this? Yes, it is a mass in the center, right? So this mass is formed by various group of muscles. So here you have the superficial transverse perineal muscle. Then here you have the 𝗵𝗶𝗴𝗃 muscle, right? And the deeper structures, you have the levator ani muscle. Then you have got the external anal sphincter, and you have got the longitudinal muscle. So what happens is, from all the directions, the muscle fibers are going to form a knot-like structure. So what will happen now? I hold all the ends, right? So whatever muscles are going to form the entire pelvic framework, All the muscles have been called. You come, you come, you come. So all have come. All have formed an interrogating mass. So what happens now? Yes, this perineal body, which is very small in structure, is going to give a support to the entire pelvic framework, right? So whatever muscles we have seen, it is going to hold certain organs. So it has been tightly pulled, it is being knotted. So what it is going to do? It is going to provide a framework, or it is going to provide support to the pelvic structures. Yes, very, very, very important point. Perineal body, what is the major function? It is to provide major support to the pelvic viscera, these structures, right? So it is formed totally by 10 muscles, 6 groups. I told you 6 groups of muscles, right? And totally, but it is 10 muscles. So I've got 2 superficial transverse perineae, 2 bulbospongious muscles. So these are the group of superficial muscles, right? And deep muscles, yes, you will be having 2 deep transverse perineae, you'll be having 2 levator ani muscle, 1 external anal sphincter, and you will be having longitudinal muscle of anal canal, right? You'll be having longitudinal muscle of anal canal. Very good. Now, what is the clinicals? Yes. So what is the thing that you need to get from perineal body? As I told you, it is a most important structure that will easily go for a tear, right? So there is a process called 𝗵𝗔𝒕𝒻𝒃. Yes, I guess I will need the help of my 𝗵𝗶𝗴𝗃𝗃. So 𝗵𝗔𝒕𝒻𝒃 is now during childbirth, right? During labor, sometimes the baby head will not come out. So what they will do is they will try to expand the vaginal orifice, right? They are going to expand the vaginal orifice so that the head of the baby can easily come out and facilitate childbirth. So what they will do is they will try to expand the vaginal orifice through the, they will giving an incision. So when that is called as 𝗵𝗔𝒕𝒻𝒃. So what is 𝗵𝗔𝒕𝒻𝒃 is, yes, during labor, right, there is an incision being given to expand the vaginal orifice, and that is called as 𝗵𝗔𝒕𝒻𝒃. Now I need to approach the vagina, right? So that 𝗵𝗔𝒕𝒻𝒃 can be done in 2 planes. One is the median plane. Yes, one is the median plane. Another one is a median lateral plane. So I'm going to either incise in the median plane like this, or I will do a mediolateral incision. Yes, can you see how I'm doing an incision? Just see. Either a median incision can be drawn like this, or I can, I can either do a median incision like a straight line, or I can go for a median lateral incision, right? So these are the 2 incisions I can do. So when I approach medially, right, what will happen is, yes, can you see in this picture? Yes, just a minute, I'll show you. So what happens is, when I do a median episiotomy, yes, I'm going to approach, right, so I'm going to go through the labia minora, yes, and I'm approaching till the external anal sphincter, yes. So from the labia minora, I expose till the external anal sphincter. So when I do an episiotomy, when I do a median episiotomy, yes, what happens is there is a increased risk for me to tear external anal sphincter. Right? So, if I do a mediolateral episiotomy, I'm just going to tear the bulbospongious muscle. So I go approach laterally, so there is a tear in the, in the bulbospongious muscle. So episiotomy is basically, I'm going to facilitate the, childbirth by expanding the vaginal orifice. So I can do it either medially, or I can go for a mediolateral incision, right? So with this, the first part is done. Now, to quickly recap, what we have seen is the boundaries. Where is perineum located? The first thing. Then we have seen the boundaries. The interior boundaries with respect to the pelvic bone, external boundary with respect to the structures that are available. Then we saw the layers. Skin, superficial fascia, deep fascia, superficial perineal pouch, perineal membrane, deep perineal pouch, superior fascia of urogenital diaphragm. Right? You have to recite it in this way. Okay. Then we have seen what is a superficial perineal pouch, what are the contents. Deep perineal pouch, their contents. Then we have looked into perineal body. It's a wedge-shaped fibrovascular mass, right, that is going to give a framework. What is the clinicals? Its most common structure to be torn is the perineal body during episiotomy. Yes, we saw when I did a median episiotomy, the external anal sphincter can be torn. So what happens? Perineal body will be torn because it gives one support, right? Similarly, if I do a median lateral episiotomy, I tear the bulbospongious muscle. So perineal body can be torn, right? So these are the information that you must know with respect to perineum part 1. If you understand this, tomorrow's class will be really interesting and easy one, right? So we'll meet you tomorrow. Take care. Tata, bye.